As an emergency physician, I carry with me certain stories that will never leave me. And I was presented with the opportunity to photograph broadly across the hospital, to share our stories with the public and also with the people and the patients who are involved in the photography as well. This particular picture is special. What's happening is that the patient has come in and is requiring intubation. And one of our lovely nurses is holding his hand and reassuring him about the process that he's about to undergo. I feel like I'm learning something every time I go in and shoot. I've learned to recognize what people are doing outside of my immediate periphery. For example, the physician that you see in the image is an internal medicine specialist, and she's in the room explaining to an elderly woman that her COVID pneumonia is worsening. And as I watched this scenario unfold, I watched our physician not only kneel down and spend time with his patient, but she also provided the care of 3 other people. She brought in her food, she helped her with her oral care, she made sure she was comfortable, and spent quite a protracted amount of time really filling in the gaps where people aren't able to visit their loved ones. This project has reminded me to take the time to ensure that our patients feel cared for, not just medically, but as a human. I had the real privilege of photographing this gentleman, and he unfortunately was someone who was going to require intubation. And this is in the moments before that procedure took place, and our nurse and our medical staff were in the room connecting with him again, answering his questions, reassuring him. And I think it really demonstrates how connected we feel to our patients and how much we hope for their recovery. We're in a global pandemic, and this is an opportunity to historically document what we're experiencing. But perhaps more importantly, these people who allow me to photograph them allow me to see their most vulnerable times. I really want to offer the people and the patients who are involved in this project the opportunity to be validated in their experience, to tell the true story of what they're going through. One of the things that I hope to highlight is that there are so many people involved in this response, and I want to include all of our members of the team, our leadership team, people who are in food services and laundry and linens and our housekeeping. They do these enormously important jobs as well in our organization and make it possible for us to do our jobs. And I think that the opportunity has really broadened my perspective of how people experience our healthcare system.